Hi everyone, I'm so thankful to be here today with Joanne Callahan, who has been a co-developer of thought field therapy, tapping, and hugely instrumental in bringing this healing technique to people around the world, and wonderful healing impacts that it's brought to thousands, hundreds of thousands of people around the world. And she's also an amazing trainer that has taught many people how to use TFT in their practice as well as on themselves. So thank you so much, Joanne, for being with me. I'm very honored to be with you here. Thank you. So I just wanted to ask you a few questions today to share some information with our listeners about thought field therapy. And one of them is just, how did Roger first discover thought field therapy?
Roger was he was a pioneer in many fields: hypnotherapy, cognitive behavioral therapy, rational emotive therapy. He was always looking for a better, quicker way to help his clients. And he was an anxiety sufferer. He suffered from all types of anxieties and phobias, and he just always thought there had to be a better way than the medications and the long-term psychotherapy. So he was always looking. And he was always looking in every direction, not just in the mental health field. He was looking at acupuncture, quantum physics, you name it. He was reading and looking, and he pulled bits and pieces out of it. And it was one of those flukes that he had been looking at the meridian system with another friend, an MD. They had gone to an AK course and then some acupuncture things. And what he found was that one of his long-term clients said they'd been working on a long-term fear of water with basically systematic desensitization, combination of that and what would have been known as cognitive or rational emotive therapy kind of thing there for a year. Her name was Mary, and she always used to say when they would have to go down, they used a swimming pool, and she would always used to say she would feel it in the pit of her stomach when they had to go down to the pool. And in studying the acupuncture meridian systems, he knew that the stomach meridian began here. And so one day when she said that, they were headed to the pool, when she said that, he said, "Tap here." And she just said, "It's gone." And he said, "What's gone?" And she said, "That terrible feeling that I have in the pit of my stomach when I think about water." And what was unique about him was he knew something happened. It didn't make sense. There was no paradigm explanation. There was no anybody's explanation for what happened. But he knew something happened. And instead of discarding it as coincidence or a fluke, he then started to see, how can I replicate this? And of course, he went back and tapped on everybody's eyes in his practice in groups, and nobody responded. But he still didn't give up. That was how he developed all of TFT. When he recognized or observed some sort of unusual phenomenon or something, even if it didn't fit any traditional explanation, he would then follow up on it, try it. And all of TFT was developed that way. Observation, trial. If it works, keep it. If it doesn't, throw it out.
Right. And
he didn't ever just have a theory that he had set out to prove. Right. It was always by observation.
Right. Great. Yeah, that's one of my favorite things about Roger is it was very centered on the client's experience. That's solely what it was centered on. So if the client didn't shift in their experience, then you need to adjust what you're doing.
Exactly.
Right? So it's completely based on the client's experience. Thank you. Quite a fascinating story.
And we heard from Mary, up until when Roger passed away, her name was Mary, and she would send us postcards from cruise ships and all kinds of fun things, and was on late TV shows with him, 20 years after the fact, kind of. So that was always fun to be able to maintain contact with her.
And it never came back.
No.
So that's the amazing thing, how quickly it worked and it never returned.
Right.
Thank you. And so can anyone use this technique?
This technique has been in use for almost 37 years now, and there is no reported case of harm. It's been self-applied by people for over 37 years with no reported case of harm, and I think there's probably very few modalities out there that can make that claim.
Oh, that's wonderful.
Yeah. So we have children, orphans in Rwanda, using it on other orphans in Rwanda and whatever, people sharing it. We had one wonderful, charming story about one of our long-term VT practitioners' daughter was all of maybe 5 or 6, and she had a cousin come over that had a severe fear of dogs, and they had a Rottweiler, and they taped this and watched her. She had taken the other little girl outside, and she didn't know much of anything other than to tell her to do like this, and led her up, and they tapped, and she got rid of the fear as they approached the Rottweiler, and it was the cutest thing. So anybody can do it.
Yes, yeah. One of my favorite things to teach people is for kids. There's a tapping point on the side of your hand, and you can tell kids to karate chop the side of their desk. And it's wonderful for all ages. Great, thank you. Mm-hmm. And can you share with us one or two of your favorite stories and what you've witnessed with thought field therapy and what it's capable of doing for healing?
I think probably the things that are most profound for me is to see what has taken place in Rwanda. The genocide in Rwanda, the stories, the things that happened were from us here in a more civilized society can just seem unimaginable. Mm-hmm. And the kind of healing that can go on from just the simple complex trauma algorithm is the kind of healing we need to have in the world. Forgiveness, healing, and change. And we had one example, which is in the From Trauma to Peace documentary, is a woman, the man that had killed her whole family, siblings, family, parents, murdered them during the genocide, moved into her neighborhood, and she was very distraught. She was plotting revenge. She couldn't handle not doing something, and full of hatred. And one of our trainers who had trained practitioners there, actually, one of those practitioners treated her, and in less than an hour, she went to that man's house and forgave him.
Wow.
And he now walks her home through the rough area of the neighborhood from the bus station every day.
Jeez.
So it's the kind of forgiveness that is so badly needed in this world. And when we see this, the same kind of healing and forgiveness in shift from hatred, despair, and hopelessness to love, forgiveness, community. We see that time and time again in Rwanda and in Uganda, in Africa. We saw it in Haiti. We see it all over Kosovo. So when you can see that, if that could be taken throughout the world, we could make a difference. If all children had that tool, then what amount of healing could be done by the next generation? So that's always been one of my goals, is to be able to do that, to have it in the hands of children. So.
Oh, that's incredible.
Yeah.
And it's something that you can't, that I couldn't imagine thinking your way through. Like you couldn't just, I think I'm going to forgive this person, so it's going to happen. It takes that profound shift at the foundation of your being in order to be able to accept and forgive somebody in a situation like that. And then for him to be able to meet her too, and just very open-hearted experience.
Rwanda's unique. Rwanda's unique for us because they're reintroducing the perpetrators back into society. So it's a wonderful laboratory actually for us to use TFT and facilitate the healing. And our trainers and people there have worked with almost 20,000 people now. So,
and that's stopping that cycle of violence, meeting more violence, and really taking a step forward.
Yes.
Beautiful. Beautiful. Any other story that you want to share?
Oh, well, one more.
One more.
This
It's
is
so good.
another one of the same kind. And what I like about this one is that it shows the bigger picture of TFT and what we're doing, not just where do I tap to get rid of my phobia or anger. It's similar in the area of forgiveness and growth. When they were working with the orphans from the genocide in Rwanda, treating the trauma the first year, an elderly gentleman from one of the nearby villages came at lunch and asked, I was forced to watch them cut up my wife and children in front of me, and then they used a machete on the back of me, and I was left for dead, but I didn't die. So I see that image every day, and it was 13 years later at this time. And can you help me? So at the lunch, they used the complex trauma algorithm, which is the tapping sequence that we have on the Foundation's trauma relief blog. And it's free to everybody too. And he said it's now a distant memory, and he held his hand out there. And he went home, and the next day he came back and he said that was the first time in 13 years he hadn't had what they call daymares or flashbacks and any nightmares. So then he said, but I'm dizzy. He said, I can tend to fall a lot. And can you help that? And one of our practitioners, actually Caroline, was thinking maybe it's due to the actual nerve damage from the injuries. But she went ahead and had him do the collarbone breathing, which is also on that trauma relief blog site. And he was able to, it aligned him, it helped align him, and he walked away. He then came back the next day with 26 villagers and said, can you help them?
Wow.
So that was, in and of itself, that was all amazing. However, the really telling part to me was he came back to the orphanage that weekend on that Sunday. And during the church service, he stood up and he said he had been given the gift of healing, and now he will take 4 orphans into his home.
Oh my God.
So he shifted from someone that was angry, vengeful, hatred, despair, hopelessness, and suffering for 12 years, from someone who could open their heart and take in 4 orphans and offer love. So that's a huge shift. And if you could produce that shift in people all over the world, in these areas where there is so much violence, I mean, we could begin to make a change in that.
Yeah, absolutely.
So those are some of my favorites.
That's incredible.
Yeah.
That's tremendous healing right there. Yeah, thank you. So many people that are going to be watching this are not necessarily in that kind of an extreme condition.
Exactly.
But we do have upsets that happen that are huge in our lives, and that can really disrupt us in our ability to have a good quality of life. So what kind of recommendation might you have for somebody who's just dealing with maybe general anxiety or day-to-day stress, or maybe you have a bad breakup? What kind of recommendation can you give to them for using TFT, for being able to help them at that level, and then carry it into positive? And once you heal that, how do you get into the next place? Like, how do you bring that into now you're thriving in life?
Right, right. Always early on, the focus in TFT has always been eliminating the negative emotions, which of course is the first step. But just because we've eliminated the negative doesn't necessarily mean that we have reached or have access to the positive. And so as TFT has evolved, so has our ability to address this. And we first can bring somebody back to neutral, and then expand their ability to reach the positive goal, or their true state of being. Our true state of being is our optimal, perfect being. And here's an excellent example. We first started coming up with this as we developed more psychological reversals or blocks to healing in any way. And you can say, for example, somebody, and this was our first case, so this is why I use this example, and it's simple. You can have somebody with a fear of public speaking, which many of us have, and eliminate that fear of public speaking, okay, and test, and there's no blocks to healing it, they're all fine. That still doesn't mean they're a confident, strong, or calm, confident speaker. And where we found was we could identify the block to getting over the fear, and they could get over the fear and feel no fear. But that didn't mean they were where they wanted to be as a speaker. They weren't a calm and confident speaker. They just didn't have any fear about it.
Okay.
And there's several things now we do with reversals and blocks and collarbone breathing and a visualization that can align them with that end goal so that they can then move forward to that end goal. Because if you're not aligned with the end goal, it's much more difficult to reach that. It's like in weight loss, the same thing. If you can't see yourself, feel, smell, know what it feels like to be that end goal and be aligned with it, then it's going to be more of a struggle.
Absolutely.
Yeah. And so this is what we've been doing with that. There's some of the newer things, is aligning ourselves to those end goals, and it facilitates the process.
Wonderful.
Yeah.
It sounds like there's so much potential for for how this can be used and what it can bring about for life changes for people.
Yeah. I think with TFT, the potential's pretty limited. Unlimited.
Unlimited.
Now see?
There's an
there
example.
we go. Perfect example, everybody, of a reversal. But notice, I didn't hesitate. That was, without thinking, I corrected it. You always want to get to that state so that you don't have blocks or negative energy. Whenever something pops up, you just correct it and go on. That negative self-talk, the same thing. You do the same thing.
And it's really a lifestyle. It's like something you get up and exercise every day, or you eat healthy every day. It's really something to be included into your daily practice for your optimal well-being, right? So
exactly.
Wonderful. Thank you so much, Joanne.
You're
It's
welcome.
been wonderful. Is there anything else you want to share with the listeners that you feel?
No, I think I use it. It won't work if you don't use it. But as Julie said, incorporate it in your lifestyle. It will make a difference.
Great.
Thank you.
Thank you. And please visit, if you want any more information, you can visit tapintonow.com. And we have some wonderful free videos on there for teaching you how to use tapping on your own, as well as more information. So thank you so much. Have a wonderful day. Thank you, Joanne.
Thank you.